Minister Dr Joe Phaahla has revealed that more interns have been entering the sector in the past 5 years. Comes as some doctors who completed their community service sit at home without work despite a skills shortage. Phaahla says the department only gets data on placements in January because some doctors go into private practice or stay in academia. The Minister joins us now for more on that conversation. Good evening, Minister, and thank you very much for coming on this evening here on News at Prime. You're saying that you would love to fill more of those vacancies. However, government just doesn't have the funds. The budgetary constraints are too severe to be able to do that. Does that not make a case for your detractors on NHI to be strong?
Well, not necessarily. Not necessarily, because it actually makes the case for NHI, because remember, the key tenet of the NHI is to say that we currently have a two-tier system where half of the financial resources spent on health for those who are on private medical insurance, spent in terms of the GDP of the country, which is spent in health, which is about 8.5% of GDP, coming from those of us who contribute to private funding. That amount of money, which is almost equal or sometimes even more than what is spent for the entire population of 85% of the population. The entire half of the GDP, if not even higher, it's spent only on 15 to 16% of the population. And if we were to pull together more resources such that those of us who have income were to contribute a little bit more into specifically a fund which looks after our health of not only ourselves but shared with those who don't have income, we would be able to spread the services and have more income, more resources. That actually speaks for NHI rather than the other way around.
But in a sense, you are saying that we would love to have more resources, but we just can't afford to pay for them. So those that can afford to pay for them, let them pay for them and let us share them. Is that not going to make the constraints even more to say, well, I mean, if we are now going to be sharing those resources, the very same doctors who are not finding space right now will continue not to find space?
Not really, Thabo. As I'm explaining that, remember, NHI is about solidarity. That's how it works. I mean, in countries which have implemented universal health coverage, is that those who have income do contribute into a health fund in addition to the general tax, and that because that's funds which are pulled together with the general allocation from general taxes, it creates a lot more bigger pool through which you are able to provide a wider range of services and provide even more professionals, because you have a bigger, access to a much bigger pool of funding. That would make it possible. I mean, you can imagine if the almost over 200 billion, which is spent in terms of within the private provision for the smaller population of those of us who have income, if part of just a small portion of that was to be able to open up even the many facilities in which are providing at many of them your private clinics, private practitioners and so on, many of whom, would see just a few patients in a day. If all those were to be available, even because, for instance, the doctors we are talking about, just around 700 whose names have been verified. I mean, these are doctors who are fully qualified for what we call independent practice. They've gone through internship, through community service. They've had adequate exposure. So these are doctors who could then be, if we had a bigger pool of funding, even be full-time employed, not in the sense of currently where your private, except the public health facilities
Yes.
Remember, currently in your private facilities, you don't have full-time doctors who are working there.
Right.
They all come in terms of who, on the basis of a patient who they are looking after.
Okay.
But we could expand this much more, and all these doctors would have a full-time and with the necessary funding.
So, Minister, for clarity's sake, I mean, I know this debate has been going back and forth between Samatu, the department, the association, and everybody else. Are we in agreement now as to the actual number of qualified doctors, verified doctors, who are unemployed, who are sitting at home currently as we sit, who are not in the system? Maybe could have applied, but they are not in the system.
Well, we are working together with both the South African Medical Association, which was the original association of medical practitioners, and then together with the trade union, which used to be a wing of the SAMA, but which after some fallout have broken away as an independent organization. So we are working with both, because both of them, the people who are talking about in their professional career, sort of as members of an association, they are in the SAMA, and in terms of especially those who have been in the public service, they are then also part of a trade union,
right,
which is Samatu. So working with both, they have both submitted, and they're working with our team in the department, going through the details and verifying, and then as we also get data from provinces of posts which they have already advertised, we then reconciling and providing guidance in terms of those doctors and where the posts are which they can apply for.
So the big question is, do you really have a strategy to retain the doctors in public service? Because you have these doctors who must go through the compulsory internship for 2 years, an extra year for community service. You literally have 3 years to plan for these doctors to put them somewhere. But as soon as they are finished, they are confronted with the fact that there are no posts for us.
Well, we do. I mean, remember that provinces and at all levels, doctors are not only in hospitals. They're starting from primary health care, from clinics, from outreach services, and right up to the highest level of care, up to the teaching and training hospitals, what we call central hospitals, like your Chris Bara, your Steve Biko, your Groteskir, and so on, all those training hospitals. So they all have what we call a staff establishment in terms of the rules of the public service. You look at your needs, you create posts. So many of them do have posts. In fact, all of them do have posts. Some of them will have fully funded and all the posts filled. But in most cases, it's not possible. I mean, they would have posts, but then depending on the allocation of funds, they will then be able to allocate those funds to activate the post and make sure that it is funded. Because, again, in terms of the Public Finance Management Act, the CEO of an institution and the DG is unauthorized to can hire somebody when they have not identified a clear budget. Now, there are many factors. One, as I've indicated in my press briefing, the output in terms of training has been growing, and as it grows, of course, we're supposed to meet that with proper financial allocation, which, with the lack of growth in the economy and all that, has not been adequate. But it then get compounded if you look at just in the last year with the negotiations on salaries. For instance, in the last year, in March last year, the unions and the government signed a 7.5% salary increase. So that just puts the cost of an employee in, because this category, the medical officers also fall within the category which benefits from all these salary adjustments. Yeah. So if you had a challenge in 2023, when you add 7.5% in terms of those who are already in the system, it just stretches the pressure on the salary bill even higher. So that's why you would find that, unless you get significant increase in the injection of funds, then you're going to struggle, which is the situation you are in. But again, as I've said, notwithstanding that, because of the fact that as people exit the community service, you can have an estimate. You see, for interns, because we know every year, even as we speak now, we know how many students are in the final year.
Yes.
And those are the people who will be coming next year to be interns, except for those who will not pass. Our team then makes provision, because if you've got 2,000 in final year, you expect roughly there will be 2,000 interns requiring positions next year. But when you exit the obligatory system, people have a wide range of choices. You can make an estimate of how many will want to remain in the system, but it will remain an estimate, unlike the other ones which are more obligatory.
Minister, I appreciate your time. Unfortunately, we'll leave it there because of the time pressure. That is the Health Minister, Dr. Joe Phaahla.